Good morning.
Good morning.
Welcome to Plastic Surgery 90210. My name is Ariel.
And I'm Dr. Katzen.
And today we're going to be talking about panniculectomies. Panniculectomies are not the same as a tummy tuck.
Correct.
And that's kind of a common misconception.
Correct.
Sometimes people will watch our panniculectomy video and go, oh, you should have removed more skin, or oh, you should have plicated the muscle.
Right, exactly.
So let's talk about the difference. What is a panniculectomy?
Well, panniculectomy, I think, first of all, is a very confusing word for the public. Mm-hmm. When I see patients for a panniculectomy, they're often fumbling on, I think I need a panny or a pannic or something like that, related to getting rid of excess skin and fat of the lower abdomen. So basically, a panniculectomy is a removal of a pannus. Okay, so what is a pannus? Okay, a pannus is anything, any skin and fat that overhangs another anatomic area. Okay? Oh. Most of the time when we're dealing with weight loss patients, we're talking about the pannus of the abdomen. But you can have a pannus of the back, technically. You can have a pannus on the neck. You can have a pannus on the thigh. Basically, it's any area that overhangs upon another area. Okay, so it can be a variety of areas. But a panniculectomy is removal of that pannus, and a panniculectomy usually is removal of the pannus from the tummy or the lower abdomen.
Okay, got it. And also, by the way,
today's
video is sponsored by our friends over at Fairgrounds. What do you have today?
The best coffee ever. A salted
cold foam latte.
Salted foam cold latte.
With oat milk.
With oat milk.
Yeah.
That's a mouthful. Get it? All right. Cheers. What'd you get?
I have an Earl Grey matcha with oat milk.
Yeah,
I love the Earl Grey matcha.
It's really good. So I usually have it with coffee, but with the Earl Grey, really, really good taste. So highly suggest it.
You could have a pannus anywhere, but we're specifically talking about the panniculectomy of the abdomen.
Correct. Okay. Correct. And a panniculectomy is just getting rid of excess skin and fat that overhangs that area. Okay? It doesn't fix the pubic region, it doesn't fix the belly button, and it doesn't plicate the six-pack muscle. So when patients talk about, and they come to the office and they're like, I lost a lot of weight, lost 100 pounds or more. I had a panniculectomy and it was covered by insurance, but I'm really not happy with the results. And I look at the panniculectomy and the muscle's been plicated and the belly button's been rearranged and the pubic region has been revised. That really is not a panniculectomy. That's a panniculectomy and then some. Maybe the plastic surgeon coded and did a panniculectomy for insurance purposes, but then went sort of over and beyond by doing some extra stuff. But technically, a panniculectomy is just removal of the excess skin and fat that hangs over typically the belt line.
So kind of just like chopping right at that belt line.
Chopping it off.
Okay.
Yeah.
All right.
It has no regard specifically for aesthetics. It has just pure regard for getting rid of excess skin and fat that overhangs.
And that's one of the more common procedures to get covered by insurance, right?
Correct. Okay. So it's much more common that a panniculectomy, removal of excess skin and fat that hangs over the pubic region, to get covered by insurance companies, as opposed to a tummy tuck. Tummy tucks are often deemed by the insurance company to be cosmetic procedures, as opposed to a panniculectomy, which are more functional procedures.
Okay. So you're saying that sometimes plastic surgeons, might do the panniculectomy, but take it a step further for the tummy tuck, and that way it can kind of get covered by insurance?
A little bit in the reverse. So they'll do a panniculectomy, so it's covered by the insurance. And then to make it look good, look better, they'll charge the patient extra for lifting of the pubic region, relocation of the belly button, and plication of the six-pack muscle.
Because that's all more time in the OR and everything.
Time in the OR, more work, more extensive plication of the muscle, more cosmetic results. So those extra things usually are not covered by insurance when you're doing a panniculectomy.
Got it. Okay. So panniculectomies aren't supposed to have the most aesthetic result. This is more functional.
Correct. Okay. And when we talk about function, it's that large excess skin and fat that hangs over the pubic region. So it depends on the insurance company, but a lot of insurance companies require that pannus to cover the pubic region. Okay. So we get into little fights, friendly fights with the insurance companies, with the insurance companies saying it's got to cover the pubic region. Well, I'm like, well, how much of the pubic region? The entire pubic region? No, it just has to cover the pubic symphysis. Well, the pubic symphysis is where the pubic bone on the inside fuses together. Okay, if you look at anatomy books, go on Google, you'll see that the pubic bone fuses and there's a vertical line of soft bone, okay? And technically by some insurance companies, they require that the pannus cover that area. Okay. Some other insurance company required that the entire pubic region be covered. When you're standing up and facing a mirror, you cannot see the pubic region. Okay. The coverage of that area can lead to rashes, irritation, trouble keeping that area clean, trouble keeping yourself clean when you're in the bathroom, trouble getting that area clean when you're in the shower. Also, functional problems like walking, functional problems like exercising. It gets in the way because you can't walk, you can't run, you can't lift weights because of the size of the pannus. And that sort of, snowballs into pannus is big, I can't exercise, and that leads to more weight, so you get sort of spun out of control.
And so do people ever have to actually lose a little bit of weight for their panniculectomy so the skin kind of falls and covers their pubic region?
Not necessarily for the panniculectomy, but sometimes patients have to lose weight to show that, one, they can lose weight, and two, to make it safer for surgery.
Got it. Okay.
It sort of really depends where you're starting from. Say you were 400 pounds, okay, and you lost 200 pounds. Okay, you may qualify for panniculectomy, okay? But if you have other comorbidities, maybe high blood pressure, diabetes, we may ask you to get down to maybe 175 to make the surgery safer. You will lose probably a little bit of skin and fat in the pannus, but that's not the purpose of getting your weight down. The purpose of getting your weight down is to make the surgery safer.
Okay. And I remember one of your patients in particular, you removed 72 pounds of skin and fat from his pannus. He started at a pretty high weight. And then for a lot of people like him, he couldn't work out and do most things, and he had abscesses that were really painful, and they would explode on him. He needed this surgery.
Absolutely. So, he in particular, I think his pannus went down to his knees.
Yeah, okay. A little past it.
A little past his knees. So, countless trips to the emergency room, countless infections. That area required hospitalizations, IV antibiotics, and sort of these things that are necessary at the time. But if you sort of step back and go, okay, if you had a panniculectomy, that would get rid of the problem, and we move on. We've had other patients where their pannus is so big, for them to get around and walk around, they have literally a small wheelbarrow that they put their pannus in and then lift their pannus to ambulate around the house and ambulate outdoors. So it can be pretty devastating, these large pannuses, of skin and fat. And sometimes, depends on the patient, morphology, the way you lose weight, etc. Sometimes these pannuses just don't go away with weight loss. So patients can lose 200, 300 pounds and still have a very large pannus.
One of the sad things about our patient that we were just saying, we removed 72 pounds. He said that his pain with the pannus, with the abscesses and everything, was a 10 out of 10 all the time.
Yeah.
The cool thing was the day after surgery, this was 16 hours after surgery, we interviewed him walking for the first time after his panniculectomy with you.
Yeah.
And he said his pain was a 3 out of 10 compared to the 10 out of 10 before surgery.
Yeah, so I find that very cool. We call these pain relieving surgeries. Patients go into surgery with pain, and then when they wake up after surgery, they are with less pain.
Yeah.
So it's kind of cool.
And that's crazy because he had a whole incision. He's 72 pounds lighter and everything. He had to relearn how to walk because his gravity was all off.
Exactly. So when you have a large pannus, after years, your body and your muscles and your bones sort of get used to walking in a certain way. And when we removed that, in this case, 73 pounds, he had to learn how to walk again because that mass was gone. Imagine the weight gone from his ankles and his knees and his hips and his low back of carrying all that excess weight.
Yeah. And the things that stood out to me was that he said he could finally sit at a park bench and have lunch with his daughter. So that's really nice. And he also had to get a new car because his previous car was modified so that it could fit his pannus on the floor as he would drive.
Yeah, so these things that you and I maybe take for granted, in our everyday life can be, major problems with patients with a large pannus.
Yeah. So at least people that are watching this that might be experiencing that know that there is a solution out there. How do they go about getting insurance to possibly cover for them?
Yeah, so I think the first step is call your local friendly plastic surgeon, okay?
And how do you make sure they're friendly?
Yeah, well, you got to call them and do a consult with them, right? So, I think probably the most important thing is making sure they're experienced. So, you can do that on your own. You can do that through consultations, but what you want to look for are plastic surgeons who have a lot of before and after pictures of the procedure you're seeking. And in this case, it's a pannus or a panniculectomy. So Google up panniculectomy, Google up plastic surgeon, Google up maybe near me. If you can't find one near you, maybe consider traveling. We have patients from out of the state, out of the country, coming for panniculectomies. We do them all the time. Very common procedure. So find someone that's experienced in doing them sort of on a daily routine, maybe a weekly routine, but you don't want to go to a plastic surgeon that's like, well, I do a lot of liposuction and yeah, we'll squeeze you in and yeah, we're going to do this for you and, that kind of thing where they've not done too many. But they're willing to try on you. I wouldn't suggest going to that type of plastic surgeon. Like anything, go to somebody who's experienced, and the best way a plastic surgeon can prove their experience is with before and after pictures and videos. So that's what I would suggest. Consult with that plastic surgeon, see what they say, okay? When we're going to submit to insurance, typically we're going to need your insurance card, okay, front and back, and then we're going to need pictures of the pannus. What you want to do and provide for your plastic surgeon is documentation of the rashes. Look, I saw Dr. X on this date, and he saw the rashes and he prescribed this cream. I used this cream for 9 months and it didn't work. Then they tried this cream. The more documentation you can provide, the more likely it's going to get covered by insurance. Because the insurance company, they don't want you to have to see a dermatologist every 6 to 8 weeks to prescribe a steroid cream when we know the problem really is getting rid of the excess skin and fat. Okay. My favorite story is we had a patient from out of state. She was from Arizona, and she had lost, I think, about 250 pounds. And we submitted for the panniculectomy and the tummy tuck and the thighs and the arms and the breast and the back, and everything was rejected. And we're like, wow, this patient really qualifies. She had a lot of excess skin, a lot of rashes, et cetera. And then we told her, the more documentation that you can provide, the more likely it's going to get covered by insurance. So about 8 months later, almost a year, she came back, and I swear her stack of papers was about 18 inches thick.
Oh my God.
It came in like 5 different packages in the mail. She didn't email it. She didn't like emails. So she Xeroxed and photographed and printed everything out. So we got these boxes and boxes of paper. I'll never forget. I'm like, okay. And we submitted everything to the insurance company. And within 36 hours, everything was approved.
Oh my
And I'm thinking 36 hours. There's only 8 hours in the working day. Maybe the people that are reading the insurance companies maybe spend 6 hours on reading it. There's no way in 6 hours they read all that paperwork. So instead, I think they just looked at the stack of the paperwork and said, approved.
Oh, wow.
Okay. So I can't guarantee that's going to happen for everybody, but I'm just telling you the more documentation that you can provide to your plastic surgeon and thus the insurance company to which we submit, the more likely it's going to get covered by insurance.
Okay, so you recommend that they take pictures whenever they have a rash, whenever they have any kind of skin changes?
Yep. Whenever you have a rash, take a photo with your digital phone, date it, time it, so we got objective proof that you had a rash at that time. And if you can, go to your doctor, go to your dermatologist and say, hey, I've got this problem, what do you suggest? And have them document it. Documentation is key.
All right. How painful is a panniculectomy surgery?
I think it really depends. It depends on the patient, depends on your level of pain. That means your interpretation of pain. So everyone's interpretation of pain is different. So I've had some patients just take Tylenol once or twice after the panniculectomy and they're done. I've had some patients take Percocet, 2 Percocets every about 6 hours, 2 or 3 months after the surgery. Really depends on the patient. But usually in general, panniculectomies are a pain-relieving surgery because of the skin irritation, the low back pain, the thigh pain, the muscle strain. So usually they're pain-relieving surgeries.
What hurts more to recover from, a panniculectomy or a tummy tuck?
Oh, a tummy tuck for sure.
Yeah.
Because with the tummy tuck, we're plicating usually 99% of the time the six-pack muscle, bringing the muscles together. And that's probably the most painful part of the procedure because it brings the muscles together. You're used to using those core muscles to move and get up, get out of the car, get out of bed. And when you bring those muscles together and you plicate them, that can lead to some pain.
Okay. Yeah, and you're doing a lot more with the tummy tuck.
Exactly, a lot more with the tummy tuck. We're plicating muscles, we're pulling the skin down tighter because, we're dissecting all the way up to the rib cage. Okay, with the panniculectomy, we're just dissecting up maybe to that belt line or that skin goes in to meet the abdominal wall.
Is everyone who is a panniculectomy candidate a candidate for a tummy tuck?
Really good question. Usually, yes.
Does it depend on how long the surgery is expected to take?
So usually the tummy tucks take a little bit longer than the panniculectomy because the panniculectomy is getting rid of the skin, it's getting rid of the fat. With the tummy tuck, we're getting rid of the skin, getting rid of the fat, doing the pubic region, plicating the muscle, and redoing the belly button. So on average, usually the tummy tucks abdominoplasties take longer than the panniculectomy.
Right, because even dissecting all the way up there to free up to the sternum takes a while.
Takes a while, yeah.
And if the patient's bigger, then even more so.
Exactly.
Yeah. Would you say most people that cover for panniculectomies are tummy tuck candidates, but not everyone?
Correct.
Okay.
Yeah.
All right. And how long is the surgery for panniculectomies and tummy tuck?
Really depends on the patient and the pannus. Okay, so if it's a big pannus, maybe it's going to take me 6 or 7 hours. If it's a smaller pannus hip to hip, maybe it's going to take 4 hours. Typically, the average tummy tuck will take about 4 hours. It may take about 6 hours depending on what kind of tummy tuck we're doing.
So what can you expect on surgery day for your panniculectomy?
Yeah, so typically you'll come in and you'll have met your plastic surgeon before that. Before the surgery, we'll have checked your labs, blood, EKG, chest x-ray, everything like that. Make sure you're healthy for the surgery. And then on the day of surgery, typically you'll get there about 6 a.m., bright and early. You avoid traffic, which is good. And then we'll take a whole bunch of pictures, get you all marked up with our surgical markers, take some pictures of the markings. Then we'll start the IV. You'll meet the anesthesiologist, you'll meet the nurse, and then we bring you back to the operating room. Through the IV, we'll give magic medication to help you relax completely. And then once you're relaxed, we give you medication to pharmacologically paralyze you so you don't move. It allows us to ventilate you. That makes you breathe with a breathing machine. And by doing that, when we paralyze the diaphragm, which is a muscle, it allows the machine to breathe for you. So you're completely asleep for this procedure. That way you don't have any pain during the procedure and you have less pain after the procedure, less blood loss, and we can control your blood pressure.
And what's it like for them when they wake up?
Kind of dreamy, okay? So they don't wake up sort of bucking and kicking and jumping off the bed and screaming in pain. It's like, when you're landing in an airplane, you kind of wake up from a gentle sleep and then boom, you're there.
Do people usually remember waking up from surgery?
Usually not. We give you a lot of drugs to help you forget the time before the surgery, of course, during the surgery, and then a little bit after the surgery. So a lot of patients struggle to remember, what it was like just after the surgery. And I have some patients who literally, don't even remember like a week after their surgery because of the medications we give you. So everyone's a little bit different.
Do people have to lose weight before their panniculectomy?
So the more weight you can lose, like most procedures, the better your aesthetic results will be after even a panniculectomy.
Let's just wrap it up by talking about how long people need to take off for recovery.
Yeah, so everybody's recovery is a little bit different, but I would plan on definitely taking off at least 2 weeks for the recovery after panniculectomy. So it really depends on your job. If you have a lot of sitting involved, maybe you can return to work 2 or 3 weeks later. If your job is very physically demanding, you're lifting stuff, moving stuff around, maybe about 3 or 4 weeks.
So if you want to see any panniculectomy or tummy tuck before and after pictures, please go to our website. We have hundreds.
Yep. TimothyKatzenMD.com. Check them out there. Go to the photo section, and we've got a lot of pictures there. You can also go to YouTube. We've got a lot of great panniculectomy YouTube videos there to watch, and even on our Instagram channel.
So if you have any questions, please comment below or DM us at Dr. Katzen MD, or you can call our office.
310-859-7770.
And we'll see you next week.
See you next week. Bye.
And thank you, Fairgrounds.
Thank you, Fairgrounds.
Cheers.
Fairgrounds. Cheers. Cheers.